Hammertoes are a contraction of the digits. So our toes are very much like our finger. We have 3 bones in our toe, just like in our finger. And hammertoes are a contraction of the toe, so from its resting normal position. We tend to have 2 kinds of hammertoes. So the most common kind is a flexible hammer toe, and that's when your toe is in that position, but we can actually straighten it out with our hand. The other kind is a rigid hammer toe, where that position is fixed and we cannot straighten the toe out. So what are the misconceptions about hammer toes? I have a lot of people that come into the office and they're concerned about why they formed hammer toes. They wonder if it's that their shoes were too tight when they were a kid or that they broke their toe. Those things can contribute, but it's usually not the main cause of forming a hammer toe. It's usually the contraction of a tendon over the course of time or the development of an arthritic process that changes the shape of the foot or the toe. So it's pretty rare that we see a hammer toe unless someone was in a shoe that was dramatically too tight for many, many, many years that would cause it to form. So the most common cause of hammer toes is something called flexor stabilization. We all use our toes when we stand and walk to balance. So we grip the ground with the toes and we push off the ground with our toes. And over time, since we grip with our toes much more than we extend them, we slowly get this contraction that happens, and then that can become rigid and fixed. Hammer toes can be painful. So we can sometimes get arthritic changes when that joint is contracted. So the joint itself can become painful. The other common problem with hammer toes with pain is that when the toe is contracted, we can rest on the end of the toe, and we don't really have much padding on that part of our toe. We usually rest on the bottom side of the toe, and that gives us a lot more pad. When we rest on the end of the toe, there's not much padding, and that can be causing pain. The other thing is that it causes our toe to raise up, and many times that will hit in the top of our shoe, and that can be painful. So there's a few different ways that they can cause pain. Sometimes it causes all of those, sometimes we don't get any of those. So the folks that are more likely to get a hammer toe are going to be those that are more advanced in age. So young people can get them. We do see them in children, but it's much more rare. So over the course of our lifetime, that contraction of the toe from gripping with our digits tends to be more progressive. So it happens more and more in folks that are older. Also because there's an arthritic component, those of us that use our joints over and over and over the course of our lifetime can wear those joints out, and that can cause that formation over time. Hammer toe prevention is a really common question that we get asked about, and it's very difficult to prevent them from happening. Since we all grip with those toes, it's usually a slow progression that happens over time. There are ways to splint the toe, but many times when we splint it, we have to wear that every single day. And so we would have to wear that splint every day for the rest of our life, and that may keep the toe in a straight position. So there isn't so much of a way to prevent it over time. So there's not any stretches or exercises. We see lots of things in magazines or advertisements on television for things, the devices that you wear on the toe or that you sleep with at night that are supposed to straighten the toe magically. But most of the time when you take those devices off, that deformity will return. So there's a wide variety of treatments for hammer toe deformity. So the goals that we try to look at in our clinic for treatment for hammer toes are to alleviate pain first and make sure that we have good function of the foot. So if that pain or the shape of the toe is making it difficult to walk or to wear shoe gear, then we want to address those problems first. And in the foot, form and function are closely related. So if the toe is contracted and it's flexible, one of the easy things that we can do in the office is called a tenotomy procedure, and we numb up the toe and then we actually make a small incision and relax the tendon on the bottom side of the toe so that it rests out again. So it's a quick, simple, easy procedure done in the office, takes about a week to recover from, and doesn't slow people down too much. So the other treatments for them that would be surgical would be to make an incision over the toe. If the toe is rigid and we cannot straighten it, then we have to remove a little bit of bone from the toe, and that allows us to straighten the toe out. And then we usually put a screw in the toe to keep that in position so it doesn't reform. conservatively, treatments for hammer toe would be things that accommodate that shape or try to remove pressure from anywhere that's causing pain. So if we have pain at the tip of the toe, there are digital devices that are made out of silicone or foam that pad the tip of the toe, and that can be helpful. If we're having pain at the top of the toe, then there are also deeper toe box shoes that keep from pressing on the top of the shoe. So there's a few different options, and I think as long as we achieve that goal of alleviating pain and allowing people to function to the best of their capacity, then that's the best way to treat.